Welcome to Med in 5. The goal of our channel is to simplify medical concepts and help you understand them with ease. This video is part of a series explaining bacterial infections. Today, we're discussing Enterococcus, an often overlooked but clinically important group of organisms. Before we start, think about the following. Which Enterococcus species is more resistant to antibiotics? Which test result helps distinguish Enterococcus from nonenterococcal Group D Strep? What's a dangerous complication of Enterococcus bacteremia? Keep watching to find out. Enterococcus species were previously classified under the Streptococcus genus and still show up in older strep lectures. The two most clinically important species are Enterococcus faecalis and Enterococcus faecium. These organisms are gram-positive cocci, arranged in pairs or short chains. On blood agar, they're typically gamma hemolytic or non-hemolytic, though some strains show variable hemolysis. They're catalase negative, like other strep species, and belong to Lancefield Group D. The most useful distinguishing features of these microbes are their ability to grow in 6.5% NaCl and their bile-esculin-positive reaction. These characteristics help differentiate them from nonenterococcal Group D Streptococcus, such as Strep bovis, which cannot grow in high-salt environments. Enterococci typically inhabit the gut as commensals. They don't usually cause problems in healthy individuals. But when they escape the gut, especially in hospitalized or immunocompromised patients, they can cause serious infections. Enterococci are a frequent cause of urinary tract infections, particularly in catheterized patients. They can also cause intra-abdominal and pelvic infections, wound infections, and bacteremia. When they reach the bloodstream, they may seed the heart valves, causing endocarditis, which is particularly dangerous in patients with prosthetic heart valves or structural heart disease. One reason Enterococcus gets so much attention is its resistance. Enterococcus faecalis is the more common species and is generally more susceptible to antibiotics. Enterococcus faecium, on the other hand, is much more resistant, especially to vancomycin. When Enterococcus is resistant to vancomycin, it's labeled Vancomycin-Resistant Enterococcus, or VRE. And its growth in patients' blood cultures is a big deal in hospital settings. Treatment depends on the species and susceptibility profile. Ampicillin is the preferred antibiotic for susceptible strains. For VRE, options include linezolid, daptomycin, and tigecycline. Combination therapy with aminoglycosides may be used in endocarditis to achieve a synergistic effect, especially when monotherapy isn't sufficient. So, who's at risk for Enterococcus infection? Patients in ICUs, those with indwelling catheters or central lines, people receiving prolonged antibiotic therapy, and people with immunosuppression, such as transplant recipients or patients with cancer, are all at higher risk. In these groups, VRE can spread rapidly and be difficult to eliminate. Infection control is crucial, including hand hygiene, contact precautions, and careful antibiotic stewardship. Let's review our questions. Which Enterococcus species is more resistant to antibiotics? Answer: Enterococcus faecium. Which test result helps distinguish Enterococcus from nonenterococcal Group D Strep? Answer: growth in 6.5% NaCl. What's a dangerous complication of Enterococcus bacteremia? Answer: endocarditis. Did you get all the answers right? Take a bow. If this video helped you understand Enterococcus, hit like, share, and subscribe. Click the link below to download the table comparing microtest results across Streptococcus and Enterococcus species. See you in the next video, and thank you for watching.